Welcome back to another episode of ACR On Air, the official podcast of the American College of Rheumatology. I am your host, Dr. John Hausman. Here's something I've been thinking about. In rheumatology, we rely a lot on tests that create distance between the clinical moment and the answer. You know what I'm talking about. For instance, you order an MRI, wait for authorization, and then wait for the report. You send for an X-ray, you wait for the report. You order autoantibodies, and it can take up to a week to get the results. But what if we could collapse that distance? That is, diagnose at the bedside, show patients what's happening inside their joints in real time, and make treatment decisions right there. Of course, I'm talking about musculoskeletal ultrasound and what it promises. My guest today is Dr. Liudmila Kastsianok, who's a rheumatologist and educator who's been living this transformation. We talk about how the rheumatology musculoskeletal ultrasound certification process works. Everything from logging the 150 scans and CME credits to sitting for the exam, as well as what ultrasound opens up in practice and research, how it changes the physician-patient relationship, and where she thinks the field is headed. Dr. Liudmila Kastsianok is a physician educator specializing in clinical operations within the field of rheumatology. Her research interests include the use of musculoskeletal ultrasound in rheumatology practice and improving access to rheumatology care. She helped to develop musculoskeletal ultrasound curriculum and currently serves as co-director for the Musculoskeletal Ultrasound Clinic at the University of Colorado. This is a conversation about precision medicine you can hold in your hand and about how this small probe can change how we practice rheumatology. Enjoy. Mila, welcome to the show.
Yes, thank you for having me. Happy to be here.
So we're going to be talking today about musculoskeletal ultrasound certification in rheumatology. But first, I wanted to ask you personally how you became interested in musculoskeletal ultrasound.
Yes. So the interest in musculoskeletal ultrasound came to me when I was first-year fellow at Washington University in St. Louis. I had a great mentor, Dr. Deborah Parks. She was teaching fellows at that time, musculoskeletal ultrasound. And as the time evolved, use of musculoskeletal ultrasound, I see it sparked my clinical interest to be better diagnostician and precise diagnostician. And also I saw the engagement of the patient to diagnose and understand their disease.
Oh, interesting. Talk a little bit more about that, how that changes a patient's perception of their disease.
Yeah. So with musculoskeletal ultrasound, when I was a fellow, right, as a rheumatologist, you try to order multiple tests, imaging, X-rays, and MRIs. And when you order X-ray, it can take a few days to get official report from the musculoskeletal radiologist. When you order MRI with our insurances and stuff, the process sometimes goes through pre-authorization, which takes weeks, right?
Oh, yes.
It delay kind of the question that patient have, do I really have inflammatory process? And having ultrasound, I refer to it sometimes like point of care ultrasound.
Mm-hmm.
If you look at A1C in primary care settings, you do that, you have a result right away. The same with musculoskeletal ultrasound. During the visit, patient tells me, hey, this hurts. I think this is inflamed. I get ultrasound, I look at the joint, patient look at the screen, and this rewarding diagnostic kind of patient-physician relationship, you come up with the answer at the moment without long waiting.
Yeah, so maybe increase patient satisfaction. And I also wonder whether, if patients see that their joints are inflamed, are they more likely to follow your instructions and more adherent to treatment?
Yeah, absolutely. When you show the screen with power Doppler signal and active synovitis on the screen, you just tell them, hey, this medication, you think it's working for you, but it's not enough. We got to adjust or change your therapy. So, yeah, again, it helps patient to be engaged in real time with the doctor that they come to see and they trust without
Yeah.
seeing technicians and long period of time waiting for the answer.
So you mentioned you started this interest in during your fellowship and you had a mentor that was teaching you how to do ultrasound. So at that time, was every fellow learning ultrasound? Was it a required part of the course of the fellowship?
It was kind of supplement to the course, and I graduated from my fellowship and I started in 2015. And Dr. Parks, she put wonderful musculoskeletal ultrasound training program for the fellows. All fellows were required to participate, but it was not requirement to become certified down the road. So every fellow kind of take their pace and interest in the process and their engagement with the process.
Got it. So
So
everybody had some basic training in it, but some people could take it a little bit further. Talk a little bit about that. Sort of what are the steps to become certified in doing MSK ultrasound?
yes, so I just want to talk a little bit about the history of the certification. So
Yeah.
American College of Rheumatology, they came up with the certification in 2013. During that time, there was growing interest in musculoskeletal ultrasound and utilization, and ACR decided to create the certification to validate physician knowledge, experience, and skills in musculoskeletal ultrasound. So certification, the exam first was implemented in 2013. And for you to sit during the exam, there is different pathways for the physicians, fellows, and APPs, and also for non-US trained physicians.
Hmm.
You're required to have certain number of the CME credit, certain number of scans over a period of time, and then you have to sit for initial certification. You have to sit for the exam.
Okay.
It's a lengthy process. After sitting for the exam, if you pass, you get the certification, the magic RhMSUS that you can put for your credentialing.
RhMSUS. So how long does it typically take for somebody that's interested? You know, if I were to become interested in obtaining this certification, how long a process does that take?
Yeah, so for the scans, you have to do for the 36 months, you have to accumulate 150 scans.
150. Okay.
And when you think about it, a lot of people, when I talk to them who think about certification, they think it's a lot, right? But truly it's not. It's you get the ultrasound probe and you do it. It can be full complete exam of one joint. It can be limited exam. It can be diagnostic exam or procedural exam. Procedural when you do the injection. I think you just have to pace yourself. If you have good mentor, right? Over 36 months, you calculate how many scans you have to do per week and you accumulate them. For the CME 24 category 1 CMEs, it's a lot, but it's doable. So one way there is US sonar pathway to kind of accumulate CME in the scans, and you can attend independent musculoskeletal ultrasound trained courses, which are available through the American College of Rheumatology, but also through other institutions.
Got it. Talk a little bit about US sonar, because I know for fellows, that's a common process by which they become certified is by getting accepted and doing the training through US sonar.
Yeah. Just one correction. US sonar does not grant you RhMSUS certification. It allows you to get all of the appropriate credits to sit for the exam.
Got it.
Okay. And I'll tell you that in my experience, talking and teaching fellows, a lot of fellows mind your sonar is the only pathway to get the credentials to sit for the exam, which is not true. Your sonar, it's a great course, wonderful course, I am not a US honor child. I did not graduate it from that program, but I was able to accumulate all of the prerequisites to sit for the exam. US honor give you opportunity, structured curriculum with scans, with mentoring to get all necessary prerequisites to apply for the exam.
Okay, great. That's a great clarification point. I wonder, so you mentioned about mentors. I wonder if I have my own practice or if there's nobody in my practice that does MSK ultrasound, how would I go about making sure that the 150 scans that I do make sense? Like if nobody's there to teach me how to actually do the scans?
Yeah, that's a great question. If you work in a big institution, you always can connect with your musculoskeletal radiologist, right? Who can overlook or give you a review on the exam. You can find your co-fellow or, somewhere else who is certified and kindly ask to look over your scans. There is a lot of training material and kind of review courses available online, which they can teach you. And another thing, your sonar, it's a great course. When you're not a fellow, when you're attending or APP, you can apply for the course. Of course, pricing would be different, but it's a available option to do.
Got it. So there's many routes to getting certified. One is US Sonar, but as you mentioned, there's many other courses and many other ways. As long as you accumulate the required number of images and CME credits, you can apply for certification. And once you get certified, is that something that you need to renew periodically, or is it a one-time and you're done for life?
Yeah, that's a great question. So as of right now, when you get certified, sit for the exam, pass exam, you get certification for 10 years. After 10 years, you can allow your certification lapse, or you can submit your CME or required scans and pay fee, and your recertification will be extended for another 10 years. You don't need to sit for the exam to recertify as of right now.
Okay, no, that's great. I wonder, as a fellow, can I ask you when you became certified in musculoskeletal ultrasound?
Yeah, so I did the 2 years fellowship. So my first and second year, truly more second year, I was focusing on getting this 150 scans. And then after I graduated from the fellowship, you have 1 year period to apply for the exam after you graduate to get the fellow's fee, which is a little bit lower than if you're attending. So I sat for the exam. You can sit for the exam in fall or spring. So I graduated in 2017. I sat for the exam in spring 2018. So I waited 7-8 months before I sat for the exam.
And is the exam purely in the computer, or do they have a component where you're actually doing ultrasound on patients or models? Or
it's only on the computer. It's a question bank. They test your clinical knowledge, some physics knowledge, and some diagnostic scans. Your skills to scan, they check by performing 150 scans in 36 months, right? And by attending the CME course. So when you sit for the exam, you should have skills to hold the probe and scan a joint.
I love it. That's great. I wonder how or if having the certification helped you in your first job. Is that something that hospitals are looking to hire rheumatologists that have MSK ultrasound certification?
That's an amazing question. So I'll tell you that yes and no. So right now with the current reimbursement practices for musculoskeletal ultrasound, not a lot of institutions, it's not requirement to perform that. Not requirement to have certification to do musculoskeletal ultrasound. In my first job, they did require, if I wanted to bill for musculoskeletal diagnostic and procedural ultrasound, they wanted me to be certified. So, and I was not able to have dedicated musculoskeletal ultrasound clinic until I get my certification. So it was kind of requirement. In my current practice, we have 3 providers, 3 physicians who are certified and who does musculoskeletal ultrasound. And the award that you get from performing it, all of other providers in the practice, they refer patient to you for the challenging injection procedures, for diagnostic scans. Your typical patient, RA, fibromyalgia, joint deformities, other joint pain coming from structural damage, or is it coming from inflammatory process? Because your approach would be different.
Yeah.
And another thing, the reward that you get, patient with high BMI, right? Sometimes it's very challenged to perform injection or arthrocentesis. I just had a case a few weeks ago when my APP, she asked for assistance. She wasn't able to drain the knee. And here the ultrasound came, you see exactly where you need to go, and we were able to drain the knee successfully.
Amazing. Yeah. One of the questions that I always have is, if I have a patient that may have some joint pain and it's quite unclear whether they have an inflammatory arthritis or I need to do a procedure, how should I think about to whom I should refer these patients? Because my options in my hospital are, well, I can send them to radiology to get an MRI. I can send them to radiology to get an ultrasound. Or I can send them to my colleagues in rheumatology who are MSK ultrasound certified to get an ultrasound there. How should I think about where to refer my patients?
So I love referring these patients to musculoskeletal ultrasound rheumatologists, because during this visit, just think about it. When patient gets MRI or ultrasound with musculoskeletal radiology, technicians are there, physicians are not, right? Here, you're real time looking at the images, patient look at the screen, and you explain what you see. Of course, if it's not your patient, right, you will defer clinical decision to your colleague, but patients love this conversation. They want to know, what are you seeing on the screen? They want to have answer right away, not wait few days, 2 weeks until they get the answer. Of course, your musculoskeletal certified rheumatologist, the skill, it's very operator dependent, right? And I have been doing musculoskeletal ultrasound as an example for quite some time. Shoulder and ankle, one of the more challenging areas for me. And if I have question after my musculoskeletal ultrasound, or if I don't see what I was expecting to see, I still refer for MRI, right? But again, you kind of skip MRI, which is more costly for patient and for the healthcare, right?
Yeah.
You can skip MRI if you find the answer based on the ultrasound.
Mm-hmm. Awesome. How do you set up your practice in doing MSK ultrasound? Like, do you have a day where every patient that is scheduled to do an ultrasound, and then some days that you just see everybody, or do you sort of mix it in?
So it's kind of mixed in. I like to have my dedicated musculoskeletal ultrasound day. I have half day currently. First, for patient convenience, because diagnostic ultrasound, if you perform more than one area, it can take some time. This is one thing. Another thing, I'm mentoring and teaching fellows for the teaching purposes, right? You want to have for the fellows dedicated musculoskeletal ultrasound clinic where they come and they scan. And I also use ultrasound as a point of care. If I have patient today who lives far away and they complaining of swollen pain joint, I grab my musculoskeletal ultrasound and do it on the go. I also want to add musculoskeletal ultrasound. There's big variety of the portable probes that you can connect to your phone or to the iPad. It's been invaluable in inpatient evaluation during inpatient rounds. When you see very sick patient, in the ICU on dialysis or heart failure, who's fluid overloaded, scanning the painful joint can help you identify, are there tenosynovitis? Are there synovitis, or are there subcutaneous edema, which is causing swelling in the area?
Amazing. So, does your hospital provide these portable ultrasound machines, or is that something that you purchase on your own?
So we purchased in our ultrasound clinic. So it's part of the rheumatology clinic. So it's available for fellows on inpatient call to kind of grab and go and do the scans.
Amazing. Can you talk a little bit about the cost of those portable units?
So portable units from around few thousand. I think it depends if it's newer machine, older machine, but it's around few thousands.
Mm-hmm. And how does the quality compare to the big, more expensive machines that you have in your clinic?
Quality is not the best. It's not the best comparing to the big 60, 100,000 machines, of course, but I mean, it can do the job. It can detect the synovitis, maybe not as good synovitis, but effusion in the joint, tenosynovitis, subcutaneous edema.
Great. Can you talk a little bit more about reimbursement for ultrasound? It sounds like, as you mentioned, that, I can imagine if you're seeing a patient and you're scanning a joint or a couple of joints or a couple of body areas, it takes longer. So how does reimbursement pay for those longer visits? Do you get appropriately reimbursed, or do you make more money, or how does it work?
Yeah, so this is the problem with the reimbursement. So procedure, it's kind of complex. So for the procedural ultrasound guided injection, it's a good reimbursement. When you go to the diagnostic ultrasound, when you look at your RVU, so total RVU that you get for the scan divided in work RVU, technician RVU, and additional RVU. On the diagnostic ultrasound, if you work for big hospital, technician RVU getting lost because I am my own technician, right? So it doesn't come necessarily to me. But there are some rules how many scans you can document, or how many scans you have to document all of the scans, but how many scans you can bill, and you have to talk to your billing department when you do that. With diagnostic scans, I usually do more scans that I bill for just based on the rules and regulations of billing. At the end of the day, more advocacy needs to be done for the reimbursement for musculoskeletal ultrasound and utilization it by rheumatologists. And it is great diagnostic tool, very helpful diagnostic tool to be precise, to be better diagnostician and provide great care for your patient.
Great. Do you have any idea of how, or do you envision that the certification in musculoskeletal ultrasound will change over time? Or is it for the last decade that it's been going on, it's sort of the same process?
I did not envision it to change. I envision it to grow, and more people recognize that it's important in getting the certification to add this kind of star behind your name that you are true, knowledgeable clinician and skillful clinician to do that and provide advanced, precise care for the patient.
Yeah. I think currently, fellows are required to have some exposure to ultrasound, but not necessarily become certified. I wonder for either fellows that are considering becoming certified or people like me that were never certified, if sort of I'm on the fence, well, how can you help people decide whether to invest years in this training to get certified?
Yeah.
What would you tell me or
I
others?
would I would say just do it.
I
It's
love it.
not years, okay? It's not years, few years. And it's a steep learning curve when you start
Mhm.
using it and practicing, but it's rewarding. Do I think every clinician in the practice need to be certified in musculoskeletal ultrasound? Not necessarily, but if you're teaching, right, and right now there is more recognition actually interviewing fellows and reviewing fellows application. A lot of fellows, they ask, what kind of training do you offer for musculoskeletal ultrasound? I think recognition and skills are important. And moving forward, even with the clinical trials, when you think about it, and precision medicine development in rheumatology, it's not depending on the protocol, it's not necessarily a requirement for you to be certified, but if you have PI who needs someone to do ultrasound of the parotid glands or synovial biopsy, whom they're going to come to? They're going to come to someone who is certified. So it enables you to have more skills to participate in clinical trials and take care of your patients.
So it opens doors. And you mentioned something that I hadn't thought about. So in my mind, musculoskeletal ultrasound is you ultrasound the joints or areas around the joints, but you mentioned the parotid glands. What other areas of the body can you ultrasound that may provide you with valuable information?
Yeah. So parotid glands to evaluate for Sjogren's, right? It will be invaluable in patient who are seronegative, not doing the minor salivary gland biopsy, right? And temporal artery, I think this is kind of the emerging area to do more. And I mean, if you're a physician who works in the ILD, interstitial lung disease clinic, doing ultrasound of the lungs.
Wow.
Right? So again, this is a little bit next step, but that's all kind of helpful skill when you have musculoskeletal ultrasound certification. You can build on it to expand your skills.
Yeah, at my hospital, we have one of the rheumatologists that's certified does temporal artery ultrasound and trying to sort of expedite the diagnosis of patients with giant cell arteritis by doing the ultrasound. So it can be very helpful because if it's positive, then you have your diagnosis right there.
Yeah, you spare the temporal biopsy, right?
Amazing.
Right, especially patients who are on anticoagulation. And I mean, it's benign procedure, but there are some complications and discomfort after the biopsy.
Absolutely. Great. Mila, any other sort of words of wisdom or words of advice for people that, either are thinking or pursuing musculoskeletal ultrasound?
Yeah, I think it's a great tool to have under your belt as a practicing rheumatologist. Doesn't matter where you're practicing. It allows you diagnostic evaluation on the fly and have the answer in the palm of your head right away. So if someone kind of thinking, should I do it or shouldn't I do that? I would say go ahead and do it. It worth invest time and money investment.
Yeah. And I love the idea of having a portable ultrasound that you could take during inpatient rounds. I was just on the consult service last month thinking back of like so many patients where we either try to do an arthrocentesis and it didn't work out, or they have swollen joints and we can't figure it out and they're too sick to go downstairs to get like imaging. So what a great concept. I'm going to even though I don't do ultrasound, many of my fellows are doing ultrasound. So I'll ask my hospitals to see if we can purchase one of those.
Absolutely. If you need recommendations for probe, email me.
I love it. All right, Mila, this has been an awesome conversation. Thank you so much for your time. And please continue doing musculoskeletal ultrasound. It sounds awesome. Sometimes I kick myself for not having done it during the fellowship. I don't know if I'm now too old to do it, but you certainly got me interested in it. So maybe I'll look further into it. But thank you so much for your time.
That's amazing. Thank you so much for having me. It was great conversation. And yeah, happy to expand and answer any additional questions.
Thank you. Well, that was a deep, practical, and inspiring look at the use of ultrasound in rheumatology clinic, as well as how to get rheumatology musculoskeletal ultrasound certification. If you've ever wondered whether to take the leap yourself, whether as a fellow planning your training or as a practicing rheumatologist thinking about acquiring new skills, Dr. Kastsianok's advice was pretty simple. Just do it. You can find links to ACR's rheumatology musculoskeletal ultrasound resources and upcoming training opportunities in the show notes. Thank you all for listening, downloading, subscribing to our show, and for rating us with 5 stars, or however many stars you think we deserve. Show notes for this and all other episodes can be found at acronair.org, on Apple Podcast, Spotify, and on your favorite podcast app. Until next time, keep ultrasounding. And of course, stay healthy.